get done in time last time. All right, let's get started. So for those of you that don't know me, I'm Brian Huber. I'm from Ohio. I'm not going to be able to sit looking at that. I know. I started with Beacon 7 months ago, and I'm starting a new model for primary care. And one of the cruxes of that model is integration with health, fitness, lifestyle. I'm not just a believer in pushing meds on people. I think we got some hearing. Does this microphone go to anything? Just that? Okay. All right. So, is that better? All right. So I started a primary care model here at Beacon 7 months ago. And one of the cruxes of that was integrating with health and fitness. And so that's how I've got to know Dell and Sarah here, and want to teach you guys some of the lifestyle changes that you're not going to hear at your doctor. And that's kind of how we got this started. So today it's all about sleep, the effects of sleep, the bad parts of poor sleep in terms of your health, and then what can we do to fix those problems. So going through, we talked about that. And if you think about sleep, I first started, what is sleep? And I didn't have an answer for that. And I think most doctors don't have an answer for that because we don't really know what sleep is. You got this kid who could sleep on anything, and they sleep 18 hours a day. And the teenagers, you start to see different, and then the end of life sleep is a very different experience. And so really, what is sleep? And if you break it down, and this is the only nerd slide I will give you, I promise. But there's two types of sleep. When you sleep, you go through REM. Everybody's heard of REM sleep. That's the deep sleep, the dream sleep, if you will. But the non-REM sleep is probably the more important. And so when you walk around all day long, you take in all this information, you see images, you hear things, you smell things, you interact, your brain doesn't need to retain all that. And so as you go from awake down to the stage 4, doesn't really matter the stages, your brain is processing all that information, and it's throwing away all the garbage it doesn't need and keeping the rest as memories. And then when you get up into the REM cycle, and you're going to do this over and over throughout the night, the REM cycle is when you paralyze. And so if you've ever woken up and you can't move, you feel very paralyzed, that's because you woke up in the middle of your REM cycle. And the REM cycle is more the physical improvement, so it's helping the body rest throughout the night. But the key is you have to go in and out of this over and over and over. And if you can imagine, most of our sleep is not very good. You wake up a bunch of times, so you're breaking this cycle over and over, and that's where you start to have the health detriments of poor sleep. And I don't want to stay on this too long. So what is our actual need? It changes throughout life. And so newborns, little kids, they can sleep 18 hours a day, and that's perfectly normal. If one of you sleep 18 hours a day, that's a problem. If you look at this from 18 on, generally speaking, you need 7 to 9 hours. Now, the problem is that's an average. And so 65 and over, there are plenty of people that sleep 4 to 5 hours a night, and that's perfectly okay. And so sometimes I'm not sleeping well. Why do you say that? Well, I'm only sleeping 6 hours. That's not an excuse for poor sleep. And so you have to realize that what is the baseline need for everybody? It's different. And then real quick, circadian rhythm. The idea is when the sun comes up, we wake up. When the sun goes down, we go to bed. Okay? We naturally have that. It's melatonin. It goes up and down. The key thing here is everybody's different. There's night owls that hate the daytime, love being up all night, and there's people like me, wake up 5 a.m. without an alarm every day the rest of my life. And so people are different. It's okay. But we'll hit this several times throughout the rest of the talk. So then it comes down to why should you guys care? And so if you think about sleep, you've probably not thought about all the possible issues if you're not sleeping well. So there's cognitive risks, there's cardiovascular risks, there's metabolic syndrome risks, There's mortality, inflammation, immunosuppression, you go on. And we're going to go through some of these real quick, but the take home is poor sleep has a much more profound effect on your health than you realize. So if you go into the cognitive side, so studies have shown that if you have 3 consecutive nights of less than 6 hours, that is equivalent to staying up for 2 straight nights. And so if anybody's ever stayed up all night long, your brain's not working right. But what they've shown is that even if you have 4 hours a night for consecutive nights, you're having that same effect. And so you need good sleep for that. Sleep deprivation is responsible for 50% of all fatal truck crashes. And so again, speed, recognition, reflexes, all these things are decreased when your brain's not happy. And they did a study of 5,000 police officers. So they screened every single one of them for sleep disorders. So 40% of all of them had sleep disorders. And what they found was, of those people that had sleep disorders, they didn't do their paperwork well. They were falling asleep behind the wheel. Uncontrolled anger complaints, missing shifts. And so again, when you're not sleeping, the brain is not working. If you go to the cardiovascular risks, and this is where it kind of gets a little more scary. So in the US, they looked at 160,000 people, healthy, no major medical issues. If you had less than 6 hours of sleep a night, you had a 12% increased risk of obesity, 6% increased risk of fasting glucose, 8% hypertension, you go on and on. And really, if you look at these constellation of symptoms, that's Americans. We eat too much, we're sedentary, it's metabolic syndrome. But what they found is that lack of sleep independently increases this risk, which then takes us to across the country or across the ocean to the UK. And they looked at 500,000 people, completely healthy, followed them for years. And if you slept less than 6 hours per night, your chance of a heart attack was increased by 20%. And even more scary is that if you reported greater than 9 hours of sleep, you had an increased risk of heart attack. And so there seems to be this happy medium of the right amount of sleep. And if you do too little, it's a problem. And if you do too much, it's a problem. And so if you look at mortality, and this is controversial, but it's kind of this U-shaped curve. So this is the chances of dying from anything. At 7 hours, it's the lowest risk. If you go, again, at 6 hours, you start to see it just exponentially gets worse. And so if you sleep less than 6 hours, your chance of dying from anything is significantly elevated. But on this side, if you sleep more, 10 hours, 11 hours, 12 hours, you're up to 2, 3, 4 times the risk of dying. I will say this is controversial. There are studies that prove both sides. It's kind of difficult to say, but eye-opening nonetheless.
Can I ask a question?
Yes.
On that side?
Yep.
Is the amount of time you sleep incremental? If you sleep 6 hours and then you take a nap at 10 in the morning for 2 or 3 hours, does that add to the 6, or how does that fit in?
The easy answer is yes. They just started changing some of the sleep guidelines to say if you have a deficit, a nap actually adds back to your original pool, if you will. But I can't say 100% that, yeah, if you sleep 2-hour increments 3 times a day, is that healthy? Probably not. Because again, you're not hitting all those different cycles of the REM and non-REM. Yep. So, and this is one thing I really want to hammer home is sleep apnea. And so when you look at sleep apnea, it's way underdiagnosed, way undertreated, and probably a significant cause of a lot of our health problems. So when you think about this, air comes through the mouth, comes through the nose. So if you have a normal airway, it's going to just come on down in the lungs. But when you have overweight, obese, big neck, as you lay flat, the heavy tongue, the heavy neck tissue, everything actually compresses down, and it pushes the mouth airway closed. And then all that weight comes down even further, pushes down, and completely blocks the airflow. That's obstructive sleep apnea. And so why do you care about this? again, the incidence is way through the roof. And so if you look at just weight, normal weight, I can't even say I'm in normal weight. A normal weight male, 11% chance you have obstructive sleep apnea. Overweight, meaning you have a BMI of 26 to 30, the incidence of sleep apnea is 21%. And if you're obese, 63% of men have obstructive sleep apnea. Now women, you guys get away with this. It's basically 3 men for every 1 woman. And basically women, the biggest risk is when you're obese. But for men, you can have a normal guy, size, snores like crazy, ends up with sleep apnea. So the men you worry about a lot more. The problem is, you look at the American dream again. So this is obesity rates. And again, in the 80s, 70s, it didn't look like this. Obesity is the issue. So this is 2022. And Indiana's number 40 out of 50 in terms of adult rates of obesity. So our obesity rate is 37.7%. So if you go back and think about this, if basically 1 in 3 adults is obese, and 63% of those have sleep apnea that are men, and 22%, we have a huge amount of sleep apnea in Indiana. And I promise you, we're not diagnosing it, we're not treating it. Now, this is more the scary part. So why do you care about sleep apnea? So again, daytime fatigue, 2 to 3 times the risk of motor vehicle accidents, significant attention, memory deficits, hypertension. And Dr. Van can point to this too. You could treat these people that have undiagnosed sleep apnea with medicine after medicine, their blood pressure is not controlled. You throw them on a CPAP, their blood pressure is controlled. So CPAP, sleep apnea, and high blood pressure, they all go together. Anybody that has high blood pressure that's hard to control, we're trained to think sleep apnea. So hypertension is a big one. This is the scary one. So they did this study at one health center. They said the next 89 heart attacks that come in and get a stent, we're going to do a sleep study on them. Okay? 57% of those had severe sleep apnea. And they tracked them, and what they found is those people that had a heart attack with sleep apnea had a 1,160% increased risk of death or a second heart attack in 7 months. And so there's a significant risk of heart disease with undiagnosed and untreated sleep apnea. And the list goes on, unfortunately. Heart failure, stroke, pulmonary hypertension, diabetes, fatty liver disease. And so again, when your doctor, I'm sure everybody in here, they've kind of pounded you on this. Sleep apnea, have you had a sleep study? Do you snore at night? Have you seen him stop? Probably him, yeah, he's probably stopped breathing at nighttime. Has he ever stopped breathing?
Yeah.
Yeah. It's because he needs a new team. But no, I mean, we talk about this, and it's underdiagnosed, and people don't realize the extent to which this disease pushes you out into all these other realms of problems. If you have a stroke, you come in the hospital, you're going to get a sleep study. I mean, it's sleep. There's a sleep physicians now. So there's sleep labs. So the sleep physicians, I believe, are internal medicine. They have a fellowship then in sleep, and they do primary insomnia disorders, but their main thing is sleep apnea. Yep. Some insurances may not require a referral. I mean, if you go down further, there's that huge, giant new TMJ and sleep center. I mean, there's a bunch of them going around. But yeah, it's a sleep physician. I mean, we can treat it, we can order it, but the only people that do the sleep studies, because they hook you up to an EEG, so you get all the little electrodes.
My son's had him, but he's still not on the specialist. I was looking for my husband. So I didn't really start for him.
Family doc, internal medicine doc. Yeah. All right, so a couple other quick things. The new thing in medicine is inflammation. Everything's inflammation. Well, they've shown if you lose sleep, even less than 2 hours, they check your blood markers, your inflammatory markers are elevated. And so we know that there is a significant cause of sleep loss with inflammation in the body. And that goes to be said obesity. So big study, basically if you slept less than 6 hours, there was an independent risk of being obese. And so people who sleep less than 6 hours, you have 3 times the risk of being obese. And then AFib, same thing. Self-reported insomnia, frequent awakenings, poor sleep, your incidence and risk of atrial fibrillation is really high. And so breaking this down in the first half is kind of why do we care? And I don't think people realize that poor sleep has significant negative effects on your health. And it's not an easy answer. To me, the sleep apnea leading to all these other issues are a big issue. But in and of itself, less than 6 hours of sleep or more, sleeping too much, it has detrimental effects across the board. And so that's why we care. That's why I'm here. And we'll get into here in a little bit what can we do, what should we do. But I want to pause for a second and see questions, thoughts, concerns so far.
What are the common symptoms of sleep apnea? Besides snoring, is it constant snoring? So,
generally speaking, sleep apnea patients come in, their spouses are usually more angry than the patient. So they'll sleep through the night, but they wake up tired, and they're tired all day long, and they're napping frequently. Generally speaking, they sleep. Now, they're not sleeping, but they think they sleep well, but they'll snore like crazy. Witnessed apnea is a big thing. So to get a sleep study approved, you kind of have to have excessive daytime fatigue or sleepiness. You have to have witnessed apneic episodes. I was thinking there was one more. But generally, those are the big symptoms they're looking for. And honestly, with our smartphones, videotape it. It's pretty obvious when somebody stops breathing for 15 seconds.
So they're not really sleeping.
Right.
They're not aware that they're not sleeping.
Yes.
So what is it they're actually doing for not sleeping?
So again, when you go back to that, there's awake and there's these different levels of sleep. So you have to go through that progression to get quality sleep. And so they're never getting anywhere. They're in that stage 1 light sleep, but they're never getting any of the beneficial effects. So when you have an apnea episode, they give you a score. It's how many per hour. I mean, if you have 80 per hour, that means you're not sleeping for longer than 40 seconds without waking up. So what happens is when you stop breathing, the brain takes over and says, hey, you need to wake up. Your blood pressure spikes, your heart rate spikes, and that's what they'll see on these tests. And then your brain will overtake everything, make you breathe again. But you literally, severe apnea, it can be once a minute. I mean, it can be hundreds of times a night. And so when you think about that curve that you're supposed to follow, you never follow. So they're asleep. They're not awake per se. They may snore themselves awake every now and then, but they wake up feeling absolutely exhausted. Makes sense?
Yeah, my kid was falling asleep.
Yeah.
But then he lost weight, I don't know.
Well, and again, when you think about the obstruction, that's why weight loss can drastically affect this. If you have a bigger neck, that's why we measure your neck too. If it's over 40 centimeters, it's likely going to be a problem. And so if you lose weight, less weight, you're going to have better outcome.
Less neck.
Less neck. Anything else? Move on.
What do you do for a living?
What do I do? I'm a doctor. Family medicine. I do primary care.
Okay. We're in this area?
In this area. So I opened a clinic over in border of Osceola and Mishawaka.
Okay.
Right by Casey's General Store on Lincoln Way East. So again, I see this every day. And whether that's...
So you part of Beacon?
I am part of Beacon. I started 7 months ago, so I'm kind of new.
So you're accepting new patients.
I am. But no, we see this every day where it's either I'm not sleeping well or I have significant concerns for sleep apnea. I mean, it's on a daily basis we deal with this. Ready to move on? All right, interrupt me if you...
Come from Ohio in the year.
The weather.
Really? Yeah, right, wrong answer.
No, I trained here at St. Joe, and then the two of us stuck around, and we have 5 kids, and so we've been here about 15 years, 16 years, somewhere in there. So.
Does sleep apnea affect your breathing during the 10 hours too when you're awake?
No. Mainly because you're not lying flat. So if you're standing up, that's why if you prop your husband up, he'll snore less, he'll have less breathing issues. But if you're lying flat, but during the day you're not generally flat. And so, and that's because I'll give you my card. Yeah.
Is there a better position for sleeping to avoid the obstruction?
On your back's the worst, by far. Most people can't sleep on their belly, but if you think about it, the weight, the spine and everything isn't going to compress because of the bones. So being on your belly would be the best. Side is second best, and then it's when you're on your back. And for the spouses, I mean, yeah, if I get on my back,
My dad,
yeah.
he's been sleeping like 2 or 3 times a day more, napping, sleeping upright in the chair. And my mom kept telling me, go to the doctor, do this. So he went to the doctor, and the doctor's like, she had trouble sleeping. And he's like, no. He's like, looks at my mom. He's like, well, let's pretend that you do. And they put him on a CPAP, and he woke up the next day, literally, big difference. He's like, I have energy now for every day. So.
Yeah.
So what are the risks of the CPAP machine? Seems like we have talked about that.
Risks?
It can be out there.
No risks. The risk would be sometimes it's not the funnest, but I mean, I can't think of a single risk of wearing a CPAP. If you don't clean it and you're blowing dirty air in your lungs, that'd be a problem, but you're supposed to sterilize it and clean it, and they give you all those instructions. But I can't think of a single risk of actually wearing it, and certainly doesn't come close to the risks of not wearing it.
What if you sleep, when you sit down and you just all of a sudden he starts snoring? You see?
I don't believe her either, don't worry.
He just starts snoring, and then I'll say, you're asleep. Yeah, he puts snoring. He said, I'm not snoring, I'm not sleeping. But he's sitting there watching TV and sleeping.
He's sleeping and snoring.
He does it quite a bit. So that...
So he has a sleep study?
He had a CPAP at one time, but he couldn't get used to it, so he's sitting in the closet.
They recalled it. Defective.
That's right. He's sitting in the closet.
Yeah. We'll get into it in a little bit. Okay. All right. Now, if I can, there was a big recall, and it was a giant pain in the butt in the last 2 years.
We never even got home from the recall. Like the one place called, and the next place called and said, oh, you did, but no, we don't take your insurance. And the next place, it was just like, okay.
It can be, once you get it, it's fine. Getting it can sometimes be difficult, and you got to jump through the hoops, just like anything. But moving on, to me, this is probably the most important thing if you want better sleep. And if you talk to any sleep physician, sleep specialist, sleep expert, they're going to say hygiene is 90% of treating your sleep problems. And part of that is the world we live in. So if you go through this, the timing, you should go to the bed at the same time every night. You should wake up at the same time every morning. Again, that circadian rhythm is a trained program. So if you go to bed at 8 o'clock one night, you go to bed at midnight one night, and then 10, and then 2 a.m., and then your body has no idea when it's supposed to go to sleep. So timing is probably one of the biggest issues. Now, that also means when you go to bed. So going to bed, how many people have a TV next to their bed? Okay, so the bed is for sleeping. A couple other things, but generally sleeping. And if you're watching TV for 2 hours, you're confusing your brain. You know, if you tell your dog you can't pee in the house, it learns to pee outside. you're telling your body, when I get in bed, it's time to go to sleep. But now you're getting in bed and watching a movie and doing this and being on your phone. And so you're not getting into that trained pattern. So consistency of the timing and when you get into bed.
What the radio's always going? I have a radio person. I have a radio going in every room I know.
So noise is different, and that gets into environment, and we'll get there. Napping, you're not supposed to do it. I mean, if you look at sleep quality, if you nap throughout the day, you're going to have a hard time falling asleep. The lady in the last talk said, well, I'm 80, and I get it. I'd say enjoy your life, do whatever you want to do, but if you want good sleep at night, you need to avoid the daytime naps.
How do sleeping aids affect the quality of sleep?
We're going to get there. We'll get there. The next three nobody likes. Caffeine, probably one of the bigger issues. I was going to have a coffee, but I felt like it would be a little disingenuous. So they really say after lunch you should stop caffeine. Nicotine, you shouldn't do it anyway, but if you're going to, it should be nothing after lunch. Alcohol, not at nighttime. And so if you think about drinking, if you drink too much, you fall asleep. But what do? You wake up all night long. And so alcohol has a pretty detrimental effect on the quality of sleep. It'll make you go to sleep, but then the rest of the night, it's poor sleep. Exercise, you know, she trains, and on her heavy days of training, you sleep really good. There's a very clear, that's my wife, by the way, in case everybody's wondering. I'm not a stalker. But if you exercise on a regular basis, you will find those days you sleep better. And the quality's better. The sleep onset is better. Clock, you're not supposed to check. We always do this. You roll over, you look at the phone, darn it, it's 2 a.m. And at that point, you've now taken yourself from level 2 or 3 when you woke up, and now you're back to awake. And it takes you all that time to get back to sleep. And so don't be checking the phone. Don't be checking anything, especially with light. Eating, no snacking, light dinner, nothing heavy before bed, no fun. And the last one I think is probably the most important along with the timing, which is the environment. And if you think about it, if you go in a dark room and it's quiet, you can sleep all night. Most of us do not have a dark room. Most of us do not have a quiet room. Most of us do not have the environment that supports this. And when you have your phone, you have your TV, you have radio, you have all these things, your body is stimulated, your brain is stimulated. So it's supposed to be quiet, it's supposed to be dark. So as you're sitting there flipping through Facebook all night long, your brain is sitting there at that circadian rhythm saying, what am I doing? It's supposed to be dark, I'm supposed to be tired, but yet you're flooding basically my eyes and my brain with light. And so the circadian rhythm gets thrown off, and so the environment is probably the most important thing. I would say probably nobody in this room, myself included, has a good environment to sleep in. And that's because of the televisions, the phones, the noise, the dogs, everything else. And I get it from a reality standpoint. If you sit here and think about this, every one of these we have life excuses. I drink caffeine all day, all night to an excess, and it's a problem. Alcohol, I mean, if you don't drink at night, when do you drink? In the morning? And then I yell at you for doing that. Sleep, televisions, phones, the kids' homework, I can't get to bed on time because of XYZ. There's always some excuse. But when you look at people who get good sleep, they're very regimented, they follow these rules, and you will get much better sleep. And so again, if I could reiterate, consistent timing, bed is for sleeping. So you do not get in bed until you're ready to commit for the night. Avoid naps, caffeine, avoid afternoon, alcohol, try not to drink too much at night, nicotine, never do it, regular exercise, small dinners, and then the environment.
I'm really good with, I don't drink caffeine, I don't do alcohol, I don't do anything. I get up every night, once, not twice, because I do the restroom, like I use, like I have to the bathroom. So, I don't know what I could do about that. I'm real regular. And
That's a-
7 a.m. every single night.
It's a very good segue. So
Okay.
Other-
Tell me next.
yeah, so other medical, I mean, if you think about it, urination. I mean, this is men, this is women, this is everybody. And there's a lot of different reasons for it. Men, we have prostate issues. We get up, we pee multiple times a night. Diabetes. If you have uncontrolled diabetes, you're up peeing all night long. If you're her, you drink water all the way up until you fall asleep. And then you have to get up and pee because she drinks a ton of water. Alcohol, another big one. If you drink, it's a diuretic. It makes you pee. So urination is probably one of the biggest disruptors of sleep. The question then becomes, why are you urinating so much? And there's lots of medical conditions that can follow that.
That probably have happened.
And again, there's treatments for it, but again, there's other medical things. Restless leg syndrome, probably a very underdiagnosed problem. And restless leg is when you lie there and you cannot get comfortable. Your legs, you got to move them. They're cramping. They're miserable. And again, it's probably underdiagnosed. It has a significant impact on sleep. There are some treatments that can get rid of it, but restless leg is another big reality at nighttime. I think probably the biggest issue with sleep and insomnia is mental health. So mental health conditions, whether that's anxiety and racing thoughts, PTSD, nightmares, not wanting to fall asleep, substance abuse, addictions, there's a lot of things from the mental health side that will lead to poor sleep. And I'll fess up to it. Everybody in here is probably on some medications. The medications we give you affect sleep. So, I mean, you have to realize that the side effects of a lot of the medications will affect sleep. And so sometimes the medicine you're using to treat XYZ is actually causing your sleep to be more poor. And
Cut off water at night. Does that help?
I would say, I mean, if you're having a problem, it'd be dinner time. Not drinking after dinner time. If you're waking up because you're drinking too much water. But if you're a water drinker, you just get used to waking up at night. The other big one is pain. And especially the older you get, you have pains, it's harder to fall asleep, the knee hurts, the back hurts, the neck hurts, everything hurts. And that's a reality. And that can interrupt your sleep, it can wake you up, and then it's hard to get back asleep because you slept wrong, and so now your hip and your back hurts. Now,
Yes, the nightmare thing.
PTSD,
What's that?
post-traumatic stress. So heavy veterans, people with, rape survivors, etc. So very traumatic events, horrible car accident, they'll get into a pattern of reliving that. And so they'll have horrible nightmares, and they'll actually get to the point where they won't fall asleep because they're so afraid of the nightmares.
You just have a nightmare.
Periodically.
So that's
This is like multiple times a night, like waking up and miserable. And again, it's usually our veterans, it's a huge, huge issue. PTSD is very common in our veterans, and there are good medicines that treat the nightmares now, and it's night and day. They'll sleep for the first time in years on some of these meds. So, but it's not just that. It can be a kid who was in a car accident, kid who saw their parents die. They'll be like this for a very long time. There's treatment, therapies, things like that, but it's a big contributor to sleep problems. So we got the medical realities, and that's the urination, everything else, but then there's just life, and whether that's children, shift work. I told the last group, I don't have an answer for you guys. If you're doing shift work and you're doing 12, 18-hour shifts 3 days a week, and then you flip to days, you flip to nights, there's no helping you. I'm sorry. It's very difficult. And even as physicians, ER docs do this all the time, and they'll flip these. You're just not going to sleep most of your life, and there's not much you can do about it.
Consider you're in the medical field and they know about sleep.
Work duties. Dogs, living arrangements. You got kids flipping houses, from different parents. Spousal interference. And so again, being with a spouse is a good thing. There's detriments to having a spouse, and now you got all these trends of sleeping in different rooms, sleeping in different bedrooms, and some people report improved sleep. Some people report actually negative effects on sleep being away. And I think, to use you as an example, you're used to his snoring, and it probably doesn't keep you up much, and you just ignore it.
We don't never shame it.
There you go.
She's thinking of it all out back.
So if you look at, tips for better sleep, what can we do? It all comes down to that hygiene. Now there's medicines. We can give medicines, and you should discuss it with us. I'm not a fan of the medicines. I think from the medical side, the CPAP is a big, significant change for treatment. But when you look at the non-medical side, you'll see a ton of this new stuff coming up, and that's kind of what I want to get into now. So when you think about sleep aids, so probably the most common one, melatonin. It's a natural part of our circadian rhythm. So when it gets dark out, we get a natural boost of melatonin from our body. That's what makes us tired. So in theory, hey, we can make this, take it hour before you go to bed. We make a natural circadian rhythm. You get tired and fall asleep. It doesn't work, to be honest. The evidence is pretty clear. You may help a tiny bit in terms of falling asleep faster, but it doesn't really change much else. You can get vivid dreams, dizziness, headache. There's a lot of side effects to it. You would use 1 to 5 milligrams most of the time. I've seen supplements up to 20, 30 milligrams. You definitely don't want to be doing that much. So from a melatonin standpoint, not a huge fan. Can you try it? Yep. You might see that you fall asleep a little faster, but the rest of your sleep probably won't be affected much by melatonin. The other big common ones, so the antihistamines. So Tylenol PM, Advil PM, everything PM. They just add Benadryl to everything, charge you more, and it's basically to knock you out. Antihistamines are sedating, so they will make you tired. And all the studies, they showed you went to sleep faster in 8 minutes, and you got 12 minutes total sleep more than if you didn't take it. So, minimal benefit. There is a low cost, but antihistamines, especially in older people, are problematic. So you get a lot of issues, and that's dizziness. If you're overly sedated at night, you're a fall risk. You can fall. There's urinary retention, and so you wake up, you can't pee. I mean, all these are real risks with these medicines, so you got to be a little careful. Will this knock you out? Probably, to a degree. Is it the savior of insomnia? Not by any stretch of the imagination. Then the last group is herbal, and you can Google 1,000 different herbal remedies for sleep. There's all these different products online. They did this meta-analysis, and that's basically you take all the studies, throw them all together, combine them all, say what did it show, and it basically showed none of them really work. And that's an probably easy way of saying it. There's probably little bits and pieces in here, but the comparison to placebo, meaning a sugar pill, there was no significant benefits to insomnia using these. Chamomile, valerian root, there's all these different herbals. Relaxium, if you watch Fox News, that's on there all the time. And basically, if you flip this around, look at the ingredients, it's probably the top 7, 8 herbal supplements. They threw it all into one pill. And a lot of the complaints about this one are you wake up hungover. So you wake up very groggy and you're still sleepy for 12 hours. So again, not my favorite thing in the world. Is it a problem to try chamomile in this? No. But again, I don't think the evidence is there to say this is the answer to our sleep issues.
Liver toxicity.
Yep. So valerian root. So valerian root is a common herbal sleep supplement. It has a risk of liver toxicity. Yep. And again, every medicine has risks, but yeah, there is an association of liver toxicity with valerian root. So music therapy. This is actually one we could probably support. in the next slide, you're going to talk about the different sleep apps. There's all these apps now on your phone, and a lot of them use music. And so music is very primal. It releases dopamine. You feel good about it. And so listening to music throughout the night, there is pretty good evidence it'll help you fall asleep. There is pretty good evidence you'll stay asleep. So it probably does help insomnia to a degree. Now, if you go to Apple Music, if you go to any of these app stores, there's 7 million channels now about sleep and what music you should listen to, not listen to. This 432 hertz is the best for sleep, and again, I've heard it many times. I don't know what it means. A lot of the music is at a 50 to 60 beats per minute, so the rhythm of the music, and that's to mimic a heart rate. And all these things are just trying to get to our primal urge of being in mom's womb again. And so music does help. I'm not against music. There's very little benefit. I would not recommend wearing those to sleep, but there's definitely some benefit of music, which gets us to the apps. Anybody use an app before I trash them? No? Okay. For the most part, it's junk. Now, there's lots of different apps, and all these apps have all these different wearable devices, and basically most of these headbands have little speakers in them, and they play music. They track your heart rate. They do all kinds of things, and nobody's compared this versus this versus this. They have a company, they want to sell their product. They say, hey, we did this study, and it showed that you sleep better with this, and that's it. I mean, there's no meat to it. So does it work? Who knows? You know, it's kind of like the CPAP. Do you want to wear that thing every night? But the last talk, somebody actually wears this one, and it just has little speakers in it, and it plays music, and she can pick what music she wants to listen to every night. This ring, this thing's $600, $700. Tracks heart rate, somehow makes you sleep better. This guy is Philips. That thing's $400. So this is the new craze, and everybody's trying to get the new startup and a new app, but there's apps that will send you texts throughout the day to remind you to not drink caffeine after noon, to not do this, to not do this, and that's the app. There's and there's apps that'll read your kids' books. There's apps that will read you books. And so, I mean, there's all kinds of different apps now to help sleep. I'm not a huge fan. I think there's promise in this in the future, but right now everybody's just trying things, and there's probably not a lot of medical science to it. And I certainly wouldn't spend $800 on a ring that makes you sleep better. There's actually smart lights, so that combine with the app, and they'll change the lighting throughout night and dim it and wake you up slowly and all these different things. So this is kind of the new thing, I think, at this point. You can listen to music. You can put a headband on that costs $400, but it basically just plays music. So I agree. I don't want you sleeping in AirPods. I don't want you sleeping with big headphones. But a speaker on the side playing a little bit of music, yeah, they are, for many reasons. A couple other things. Weighted blankets. If you've ever seen these, they're just heavy blankets. They weigh 10, 20, 30 pounds, and you lay them on top of you and you smother yourself. It's supposed to help you with sleep. Generally, there's signs that it helps with anxiety, not much that it helps with sleep. CBD, live next to Michigan. CBD always comes up. I would put CBD in the same with alcohol. It'll probably make you go to sleep, but it's not going to be good sleep. And I'm going to leave it at that so we don't argue. This is a new one I just threw on. Everybody was very interested in this last time. Cold water immersion. So it's a new kind of thing. You jump in a bunch of cold water. You scream, you yell. It's horrible. I do it. She does it. But it boosts a lot of dopamine. You get a lot of dopamine. It can improve sleep. I would say it's good for a select group of people, not somebody that has heart problems, not somebody that's going to have an issue if you jump in 32-degree water. But it's out there. Then a couple other miscellaneous ones. So sex, we know sex improves sleep. Orgasms clearly improve sleep. Mattresses, you look at this, sleep number, Tempur-Pedic, goes up and down, heats your feet, all these things. Probably none of it matters. I mean, it's more about being comfortable, but buying a $15,000 mattress that your sleep IQ, your sleep score, all this stuff probably doesn't change anything other than your wallet. And then talk a little bit about partners. And so, again, you get used to sleeping with a partner. The Canadians, they did a study where they took your partner's scent and they had you sleep with that scent, and then they had you sleep with other scents and they didn't tell you. And they found that if you sleep a lot better when it's your partner's scent. So I do think sleeping with a partner has a significant benefit to that, but there's also the partner that snores and does everything else. So it's kind of you got to weigh the benefits and the risks. And then, so I want to talk about CPAPs real quick, and then we'll get to questions. So again, you go back to this slide. So what CPAP does then is it covers the nose or mouth and shoots a jet stream of water. Water. Hopefully it's not water. Air. And the whole idea is to basically force this back up. And so, I mean, it's kind of like a leaf blower being attached to your face, and that's the whole idea of it. Now, CPAPs themselves have a bunch of different apparatuses, as we kind of went through.
Water?
I misspoke, but most of them do have actually water in them. They humidify. No.
Okay.
I don't even know what that is. These mild sleep apnea, you can get away with just the nose. And people with severe sleep apnea are not going to get away with this. Most people have this. Covers both the mouth and the nose. You're shooting air through both holes and keeping it open. For severe people, some people need BiPAP, which is a step above CPAP. You get the whole face mask. It's all about comfort. It's all about fit. You got facial hair. This thing is not going to seal well. You're going to get leaks. So there's a lot of different things that you look at for CPAPs. But it's one of the certainties in medicine. If you use this, your apnea is treated. I mean, if you do it and you wear it right, it will get better. And all those risks we talked about, they're not gone, but they definitely decrease. Meds. I'm going to brush through this real quick. I'm not a fan of meds. I'm not. So when you look at meds, sleep onset, sleep maintenance. So there's medicines that'll knock you out, and then there's medicines that will keep you knocked out. Most people, 50% will see some improvement. But generally speaking, it's nowhere near, oh, I sleep great now because I take this medicine. And you have a significant risk. So falls, hip fracture, death, especially the older you are. You've already all mentioned you're getting up several times to pee. Now we give you a medicine, you get very sleepy. You wake up at 2 a.m. to pee. You're stumbling around, it's dark, you can't catch yourself, you fall. So the sedating medications are certainly putting you at risk of a lot of complications. There is significant medication interaction. And if you look at these, I mean, benzodiazepines. So benzos are very common back in the day. So, I mean, I got patients, I'm sure you do too, that have been on these for 30 years, and I got to take it every night or I don't sleep. But really, these are alcohol in a pill. And so benzodiazepines are literally just a pill form of alcohol. And so it will knock you out. It can help you, but there are significant downsides. And so it's about weighing the risks, weighing the benefits of these. They are. Well, they're for feeling good. But really, these are now frowned upon. So they created a whole new list of meds, Ambien, Lunesta, all these, and basically these are all benzodiazepine-like medications. So we took the narcotic part out, try to continue all the good stuff, but not have it be a narcotic. And the Ambiens and Lunestas, same thing. You're out. I mean, you're out for 8 hours, 10 hours, 12 hours. And so you shouldn't be driving. You can't wake up in the morning and go to work. So there's a lot of downside to these. Most of these are approved for short-term use. You shouldn't do more than 2 weeks at a time. People do get on them long-term. And again, it's hard to get off. but at the same time, my overall sense is medications are not the answer to poor sleep. There's so many other safer ways to deal with sleep. I'm going to leave it at that. And so, summary, and then we'll take questions. So, I mean, in reality, sleep is good. Don't sleep too much. Don't sleep too little. For the most of us, we don't sleep well. That hygiene is by far the most important thing you can do. Habits are hard to break. It's hard to get the TV out of your room now that it's been installed and on the wall. But at the end of the day, watching TV on your couch, getting in bed, falling asleep immediately is the proper way of doing it. Meds are not the answer. And basically, the single most important thing tonight is that sleep apnea. It's just underdiagnosed. A lot of people have it. We need to ask your doctor about it. So,
What about, they have this new, that they put in you for sleep apnea?
implant.
Yeah.
Somebody asked me about that last meeting, and I've heard of it. It's called Inspire. Somebody looked it up.
Inspired.
Do you know anything about that? Yeah. Yeah. I know Dr. Collins, an ENT in town, does it, but I don't know much about it. It's supposed to put some sort of pulse or something in your system to help you keep breathing, but inside you, yeah. They put it down somewhere in the airway, but I can't speak
I
to
just
it.
wonder, I asked the doctor about it, because people who use the CPAP, about that. And she said, yeah, it's an implant. You want to go in and have surgery and have an implant?
And I
It senses your breathing, and if we're breathing, then the machine goes off.
I think it's a pacemaker for breathing.
Yeah, that's exactly what
And then
we
wake
think.
up.
That's,
Perfect breathing.
I'm going off minimal knowledge, but yeah, that's, I think, how it's supposed to work.
I just wondered if you had any knowledge on menopause.
Yes. Personal?
Yeah.
I used to be pretty regimented in my sleep
Yep.
with an early bird, and now I can sleep to the house.
Menopause is such a biological change for women. Now, when you look at, again, that sleep cycle you're supposed to go through, how many times you wake up sweating, throwing the covers off, and then finding the covers again, and then throwing them off. And so, is it kind of like a sleep apnea where you never get the pure good sleep, so you wake up feeling absolutely exhausted? That makes sense. But at the same time, your whole body's changing. And so the lack of estrogen changes everything, the FSH, the LA, all these things change, and that's going to make you feel different too. Now, I wouldn't say that that's the only thing going on. I mean, personally, if I just hear this story, I'd say, okay, all right, you can blame some of that. But for the most part, menopausal women don't come in and say, I can't wake up during the morning. They usually wake up angry, if anything. But I would wonder, yeah, is there more to it than just the hot flashes and some of the other symptoms? That's something I could read on and get back to you. Do you have any thoughts?
Well, I think the main thing about menopause and sleeping is that I guess we just have to realize it's like days.
Yeah.
So our sleep is going to be disrupted, and we make things not to be disrupted and not to make more of it than it is. I mean, just, and I go with my personal experience because, you know, I'm a physician and then also a woman so you recognize that it's a phase, you just know that it's not going to be 2 less hours, it's okay. As opposed to, you know, fighting and stressing about it and,
Yes.
and then it goes into a cycle. You know, I think a lot of patients, when they get angry or when they get scared, and the next morning they're not going to get enough sleep. Then it cycles and it's not affected.
Yeah.
So I think menopause is one of those things where, you know, it's just a phase and you just go through it.
But I'm not the joy of this yet. Why would you be getting 2 less hours? Like, what would be going on?
Oh, I'm sorry. You know, just like the hot flash.
Yeah, it's the
Hot flash
symptoms.
or like, sort of going like it's on and off. So it's disrupting.
Yeah.
Because of it, I'm not gonna get people.
Yeah.
So, but then you go through it.
We also have to report to.
So it's one of those things I think we don't want to medicate, we don't want,
Yeah.
we don't want to run and get things fixed, and we want to get
It's fans and then heavy blankets and then fans and then heavy blankets. Other questions? All right. Well, I appreciate it. That's it. Yeah.